Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers, producer of Public Health on Call, and we want to hear from you. In more than 500 episodes since March 2020, we've been bringing you the latest on urgent public health topics like COVID-19, climate change, gun violence, monkeypox, racism, and more. We'll continue to cover these, but we'd like to know, what other public health topics would you like to hear more about? Plus, you can enter to win some amazing podcast swag, including the beach tote featured on our Twitter account. Please go to publichealth.jhu.edu/publichealthoncall/survey to take a brief survey of potential future topics. This will be open until September 9th, and that link is publichealth.jhu.edu/publichealthoncall/survey. We're excited to hear from you, and thank you so much for listening. Today, Stephanie Desmond welcomes back Dr. Elizabeth Stewart and Dr. Carrie Althoff, two Johns Hopkins experts. With back-to-school time upon us and new CDC COVID guidelines just released, they discuss how parents and students can prepare for another pandemic school year and how much they should be worrying about other infections like monkeypox. Let's listen.
Elizabeth Stewart and Carrie Althoff, thanks so much for joining me.
Thanks for having us.
Good to see you.
We're good to have you back. And sort of just in time for back to school, we're seeing new CDC guidance for how we're supposed to behave during this pandemic. And so I see we're moving away from quarantining and distancing. The timing to me is a little strange, only because we still have lots of COVID around. So Liz, talk to me about what you've seen and how you feel about these new guidelines.
Yeah, it's such a challenging time right now as we've continued to have these conversations over the past 2.5 years. At each stage, it sort of feels like, are the guidelines sort of ready for where we are in the pandemic? I think in general, we really need to be able to pivot and be nimble, and we aren't fully seeing that yet, but sort of as a society, we need to be able to start doing that. So CDC is sort of starting to steer the ship in a slightly different direction than we've been going. There's a lot of concern about the balance of sort of personal responsibility and putting a lot more on individuals, especially those who might have immunocompromised family members or themselves, because it is moving away from a longer isolation period, moving away from quarantine, sort of more to that kind of personal responsibility idea of people should decide themselves if they will mask, less in the way of mask mandates, less testing, again, shorter isolation periods. On the other side, one thing that was really good to see in the new guidance was more focus on ventilation and some of these structural pieces. Continued focus on vaccination. So some of those fundamentals that are going to be structural pieces that will really help. But then I think we're going to need to be better about being nimble about the things that sort of might change more rapidly.
Carrie?
I think the CDC guidance really is kind of playing catch up with where people are in the pandemic and kind of what they're willing to do, for better and for worse, right? And so I think this idea that we've removed quarantine recommendations, regardless of your vaccine status, whether you're vaccinated or unvaccinated, boosted or unboosted, that's gone. But there is still, encouragement to mask for 10 days and to test yourself at day 5 if you believe you've been exposed, just so you don't inadvertently spread this forward. But I think one of the things that this impacts most dramatically is the removal of test to stay programs in the schools. So if your child is exposed to COVID in the school, these test to stay programs could help your child stay safely in the classroom. And now with the removal of quarantine for those who have been exposed, regardless of your vaccination status, those kids won't be testing, they'll be staying. And so I think, what this means for parents and and people in workplaces who had test to stay, where that will be reduced now. It really is thinking a little bit more critically about what are your actions going to be when you hear of a case in your child's classroom or a case at work. Will you decide then to mask up for a couple of days to reduce your exposure? Will you decide to mask up because you're going on a trip and you don't want to get COVID before that trip, or because you're going to see a family member who is immunocompromised or in a residential facility? So I think there are a lot of pieces there that come into place. This idea that we're also going to remove testing as screening, with the exception of a few special circumstances and areas, is also interesting. We were seeing this done a lot in the schools, and a lot of parents were like, okay, but my kid has like this asymptomatic infection and that was caught on a test, and now they're home for a few days and they seem totally fine, but they're home. And schools have been so stretched to the limit that there wasn't a lot of support in many situations for those kids who were at home feeling pretty good, but not being able to kind of like engage with their curriculum. And so we're trying to reduce those burdens on families and keep kids safely in school in particular, because we know how critical that is, and keep adults safely in their work environments as well. But I think the take-home message for all of this is, if you have not been vaccinated yet, the rollback in some of these mitigation strategies through these policies means that your risk level has changed, right? Even through no different actions of your own. So really critically thinking and getting your questions answered about the vaccine, making your choice again about whether or not you'd like to be vaccinated. Now's a moment to do that. It's time to think about that again. And then for everybody else, are you boosted? Where are you? Particularly as we head into the fall, when people start to go back indoors, and indoor spaces are going to become more of our norm for both work, school, and social engagements.
I used to get, during the school year, letters every day about how many people were exposed, how many people tested positive, et cetera, et cetera. Well, are they even going to be telling me that anymore?
It's such a good question. And that was one of the things that I was very surprised by in the new guidance, was less reliance on testing and surveillance testing, just to have a sense. Because as Carrie was just alluding to, it's hard to pivot your behavior if you don't have the data to know kind of where case rates are currently. And part of the challenge is that right now it is hard to know that, with different measures and fewer PCR tests, more just at-home rapid tests. I think, we need to be very careful about making sure that people can know the current situation in their local community, so that they can, as Carrie was saying, wear masks when cases are going up, that sort of thing. There's some push in some areas towards wastewater surveillance, and ideally that could even be done at a school level at a very low threshold, just regular surveillance, but we're not there yet. That isn't happening. So that is a hypothetical and happening in a few locations. But right now we're going to be somewhat more blind in terms of where case rates are to be informing some of these decisions.
So my kids and your kids can't go to school unless they've been vaccinated against a whole litany of diseases. Here we are. I know that, Liz, your kids are in DC, and there is a requirement for being vaccinated, but a lot of places there's no requirement for the kids to be vaccinated before they go to school. And I'm wondering if that is something we should see more of.
So I think that this idea of requirement for vaccination to attend school is something that we have to recognize, just as you said, Steph, that this has been happening for other vaccines for decades, right? So to send your child to school, oftentimes you do have to fill out your state's health form for your child, and it does talk about your immunization status. But here's COVID, right? And there are some people who still have concerns about the vaccine and its newness, and the post-marketing studies are showing us that these vaccines do work well, even in small children. We are not seeing signals of a greater harm from the vaccine than the benefit of being vaccinated. So I think overall, we know these vaccines are safe and effective. And the bottom line with all of this is that there are going to be some places that require vaccination, and there are going to be other places that don't. My kids in both public and private schools are not required this fall to be vaccinated or boosted. Their mom is requiring it, so they will be. But the school is not. And I think, the one thing that we have to remember whenever we make a requirement, you have to put resources towards that, and not resources towards making the requirement and that process, but resources towards making sure that people have access to the vaccines. And Liz, I know that you have more familiarity with how that has been happening in your public school district because they have made this recommendation. Do you want to tell us a little bit about that?
Yeah, I'd be happy to. To be just a little more precise, what the guidelines are for DC public schools is everyone 12 and up has to have started at least their vaccination course a couple weeks into the school year. I do want to give credit to DC government because they've really, I think, done a very good job of making resources available throughout the city. So to school kids, but also more generally. There are COVID centers spread all around the city where you can walk in and get free rapid tests, free masks, vaccination on site. They've made it quite easy. And I think that is really important if we're going to be moving, especially to this model where, masking maybe isn't required. It's more of you take personal responsibility. We want to make sure that people without resources can get high quality masks, can get rapid tests to use them if they are sick or if they're worried about visiting a family member. And I do think DC has done a pretty good job of ensuring that around the city. I'm sure it was a tough policy decision for DC public schools to require the COVID vaccine for kids 12 and up, because the rates are not close to 100% yet. So there is still work to be done. But again, they're doing a blitz right now with lots of vaccination clinics all around the city in the coming weeks, and just really trying to move that. And I think it's important too, these balances of sort of, will this keep some kids out of school at the beginning of the school year? But the hope is that with higher vaccination rates overall, that then there will be fewer missed school days throughout the year because the kids won't be getting as sick and won't need to be staying home. So tough policy decisions. But again, I just wanted to emphasize this point about making sure that the resources are available for these different policy choices.
We're hearing a lot about other diseases as well right now. I mean, COVID, of course, but we're hearing about monkeypox. We've heard of a resurgence of polio in some places. We're hearing about outbreaks of RSV and hand, foot, and mouth disease. It feels like all the kind of things that will become a problem when lots of people gather together, kids as well, especially on many levels, like that these are also sort of not new, but they're serious issues, and monkeypox is a fairly new issue. And so, Carrie, I'm just kind of wondering what parents should be thinking about as they send their kids back to school.
So monkeypox is a situation that's being monitored and followed as closely as we possibly can. There is a shortage of resource when we're talking about vaccination. And these vaccines are being sought after by the population that is currently most impacted by monkeypox, which includes men who have sex with men. And I think what we have to recognize here is that when there is a need for resources and we don't have those resources immediately available for those who need and want them, that is a really hard challenge in public health. And it isn't one that we are unfamiliar with, sadly, right? We were at this place also at the beginning of the pandemic when the COVID vaccine wasn't available as widely as we wanted it to be, because it does take time to make these vaccines. And it does take both state, local, and federal government push and investment in order to get the vaccines what we want when we want them. They've just now made a suggestion to modify how monkeypox vaccine is administered so that the doses that are currently on hand can go farther. And that's just with the difference in the route and administration, and working through any concerns about whether or not that is as effective as the intramuscular injection, which is how it was designed to be administered. So there are a lot of questions there. And here's the thing about monkeypox. There is a population most heavily impacted right now, and the resources need to get to that population to slow this down. However, this virus will transmit through its routes, regardless of who you are. So we are now starting to see spread from the most impacted population of men who have sex with men into other populations because of the route of transmission of close personal contact. And so daycares, right? So there's been an outbreak noticed in Illinois in a daycare setting. And that is because anybody who's had their kid in a daycare, you want your kid in that daycare where the adults there are loving and caring and give hugs. And for infants, have them up on the shoulder and those nurturing moments between the caregiver and the child. But that close personal contact can be routes of transmission for monkeypox. And so, we are anticipating that we will start to see more monkeypox in some of what we call our sentinel surveillance populations. For example, pregnant women. We'll start to see it in the daycares. College campuses are likely to be another place because there's a lot of close personal contact that goes on college campuses. And, it's hard because we don't have the vaccine to distribute to all of those places right now to be used effectively for everybody who wants and needs the vaccine. However, it isn't an all or nothing situation. As we continue to wait for that vaccine, we have to continue to cultivate trust and build awareness about what monkeypox is, how it's transmitted, what are the ways that we address it. And so, on college campuses, I've been hearing more chatter about bringing back testing days. So some college campuses do this where it's a big student health fair in the first few days, and you learn all about the testing services at Student Health. And, they even do on-site blood pressure, glucose monitoring, all of the testing, sexually transmitted infections, as well as chronic disease surveillance tests and ways to monitor and look for whether or not those chronic diseases are beginning in youth, essentially, and in our young adults in college. So bringing those back to, refocus our lives on health. And I feel like refocus is kind of not quite the right word because we've been so focused in this pandemic, but it's about holistic health, right? Like thinking about, are my kids up to date on their vaccines? I will be honest, I have one child who is out of compliance because we have, moved around different appointments. And so we're on top of that now. And here, I'm in public health. I know how important it is for my kids to be vaccinated. I'm a believer. And, life has gotten in the way. So it is taking a step back now at this point in the pandemic and recognizing my kids' immune systems probably aren't the same as what they were before the pandemic, just in terms of their exposure to the routine viruses like RSV, like influenza, like all of these things that we're hearing more and more outbreaks for. So how do I use these tools that we have become more aware of in the pandemic with hand washing and encouraging schools to have improved ventilation and telling my kid, I know that's not COVID. We just tested you, but you still have a cough and I don't know what that is. Put a mask on. Let's go. You're going to school, but get your mask on. I don't want some other parent to be in this state of kind of worry that I'm in when you give their kid your cough, kind of those types of things to create that more holistic picture of health, to keep us all kind of moving forward and in our usual activities in a safe way.
Carrie Althoff and Elizabeth Stewart, thank you both so much for joining me.
Thanks, Steph.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.